Hey guys, Kevin Runlet with Runlet Law Firm again. Today we're talking about back injuries. Back injuries suck. We understand that. People that have not experienced back injuries don't understand, and I just wanted to talk to you about today about one of the most common types of back injuries that we see, and get into some of the other types that also occur. Regardless, a back injury can be debilitating. It can be annoying. There's two ends of the spectrum. It can be just a little bit of pain. It can be something that prevents you from walking or working. The most common type of back injury that we see is lifting injuries. And most commonly it's in the lower part of your back. In the lower spine you have lots of muscles that support your back. You have nerves, you have vertebra, and you have discs in between those vertebrae. A lot of times people lift things improperly. We have a hinge between our hips and our backs, and when they lift things and the weight's out here and they're here, that creates a lot of force in their lower back, and that can cause either muscular problems, it can cause disc problems, and we see it quite a bit. So that's the main type of back injury that we see. And in a workers' comp scenario, if you are at work when this happens, it is a compensable claim. Whether you picked something up improperly or not, it doesn't matter. In a workers' comp claim, a back injury is a back injury, and your attorney should help you get the treatment and the relief that you need to get back to work as quick as possible if you can, and if you can't, get you compensated properly through the Mississippi Workers' Compensation System for that injury. So it is common. We see it all the time. There's actually few people who haven't experienced some back pain. Even if there were pre-existing back pain and something happened to exacerbate that or make it worse at work, it could be a compensable claim. Now there are other types of back injuries, of course. Trauma can cause fractures in the spine, anywhere from the neck to your lumbar. But most commonly we see issues with the lower back, and that's just from repetitive use, from lifting something improperly. Lifting something properly and just a disc herniates in your lower back, which impinges on nerves, which causes great amounts of pain. So we understand this. We can help people if they've been injured at work or because of somebody's negligence, get the treatment that they need, get them back to as close to as normal as possible. The progression of treatments that's most common with a low back injury would be conservative measures, where we try some physical therapy, strengthen the muscles around the lower spine. Your doctor would prescribe this, of course, not us, but this is what we see. So that's the first step, and if that doesn't work, the doctor may recommend some type of steroidal injections in your lower spine to relieve that pain. Check that out, see if it helps. If it doesn't, last resort would be surgery. And of course, that's a whole nother discussion as to, what are my chances of getting back to 100%? If not 100%, how close to that should I expect to get? So if you have questions about a low back injury or a spinal injury of any type, we've handled lots and lots of them, and we'd love to talk to you about it. Hit that subscribe button below if you like these videos. Give us a call, send us an email. We're here. Thanks.